coordinates with the study guide, and so we'll go over that. If there are any questions, please feel free to just jump in, and I will answer you, or throw something in the chat and I'll answer that. Okay, any questions before we start the review? No. Okay, I need everybody to put their name and their professor in the chat, because that's how we take attendance. Okay, put your name and professor in the chat. If you're mine, you don't have to put me, because I see 1, 2 that are mine. You just put your name in there. I know who your professor is. Okay. All right, so I'll welcome everybody. My name is Professor Aloni, and I teach community along with everybody else. So we all work together to create the exam. So when we do these study groups, it's really good to go to a few of them, because all of us present differently. All right, let's take a look at, I'm going to share with you a PowerPoint that we all made together to help with the study guide. So I'm going to pull that up. Can everybody see it? Just say yes, because I can't see everybody.
Yes.
Okay, thank you. Okay, so alrighty, so like I said, please put your name and your professor in the chat just to make sure. So we look at exam 3, it's going to be 11, 12, 25, 26, 27, 14, 15, 16, 17, 4, 5, 13, 28. Do know that I'll emphasize on all the reading that you guys had for this week. You're gonna, I'll emphasize what you need to know. Okay. So on the first section, we're going to look at community. And when we look at this, some questions you might come up are, how do we determine communities? What does community look like? Things like that. Okay. So we know it refers to the people, place, and function. When we're looking at a community, things we're going to focus on are going to be our census data, our tourist bureau, our civic groups, and our churches. Libraries, police stations, and welfare agencies would be data sources to measure the functions dimension, and the dimension of the place would be measured with data sources such as maps, newspapers, and local housing office. So if I were to ask you a question about that, what if I were to ask you, what would be a good way to measure the dimensions of people?
Mr. Aloni, the
Yes.
audio is cutting in and out.
I hear you're cutting in and out. Is it cutting in and out for me too?
Yeah, it's cutting in and out.
I'm cutting in and out.
I can hear you fine.
I think it's your
Yes.
connection, whoever's
So
telling me.
I'll restart my computer and see if it
Okay,
helps.
see if that helps.
Okay, I'll restart.
All right, and you let me know, okay? I'm gonna share my recording as well with all the professors. So if you guys have any questions, can somebody mute whoever that is? Hold on. Okay, so I'll share my recording, so don't worry if like it gets choppy or whatever. If it's not me being choppy, it should be fine, okay? All right, let's go back and take a look. So a question might be, how would we measure the dimensions of a community or dimensions of people? What would your answer be? We're looking at dimensions
Using data
of people.
sources.
Okay, give me some more. You got it. Keep going.
Like vital statistics.
How about census data?
Okay.
How about tourist bureau?
Civic groups,
Civic
churches.
groups and churches. Good. So on your study guide, you want to highlight that, okay? When we're looking at a community, generally speaking, what are some things that we will look at? How about maps, newspapers, housing office, police stations, libraries, welfare agencies, state departments, okay? This is just really how would we assess a community, which you guys at this point know. But when we're looking at a community assessment, we're going to look at things such as politics, education, religion, you know, what's in the environment that we notice, economics, right? All that's important. So we have politics, education, recreation, economics, religion. What else? Anything else? No? Okay. All right. And then we have active versus active versus passive partnerships. Remember, active is when you're going to be thoroughly involved in it, where a passive is you're going to observe things from a distance. So we're going to have active participation. We'll have our community leaders, our businesses, or organizations develop these programs, and the programs are going to be bigger than those passive ones that might be very specific and not as inclusive. Okay, so something like active versus passive community partnership might be a good type of question. So a city creating a new park, a hospital providing a vaccination clinic, and a recreational center doing cooking classes, that's going to be more passive. Whereas an after school program that we're going to have a business involved in, it's going to have much more people involved in the community. So it's going to be a more active function. Does that make sense? Yeah. Good.
Yes.
Thank you for answering. Okay, data collection and interpretation. Let me move fast so that you can see this whole thing. All right, so when we're looking at data collection, primary goal is going to get information about the community and its health. How do we do this? We gather existing data, we look for the missing stuff, we interpret the data, and then we identify those health problems as they come up. Okay, so we really need to make sure that we're doing this step by step, level by level. So if we're looking at some data and we want to know what is our goal of collecting that data, what is our goal when we're collecting data?
To gather information.
Gather information. And what's the information going to be about?
The community.
Yeah, community. And we're going to look at that information. We're going to look at records so that we know what's already there. We're also going to look for things that are missing. What can we find out? So data collection is how we do this. And we're going to look at readily available things we're going to look at when we do data gathering about a community. We're going to look at the age, we're going to look at gender, socioeconomic characteristics, racial distributions, vital statistics, community institutions like healthcare, hospitals, and personal characteristics regarding health. Okay, so the question you may see might be something along the lines of select all that apply when doing data gathering. It's not going to be that easy, but something like that. Okay. And then we'll skip that one. When we're looking at assessment and assessing the community's health, we're going to make sure that the nurse understands individuals, family, and group problems and know what their strengths and weaknesses are and what kind of resources we can look at. Know that we're helping with assessment to identify what's the community needs. We do this sometimes with a windshield survey where we're going to collect data by observing the community through a car or a ride in a bus. Our windshield survey, the nurse will need to understand the boundaries. Remember, we talked about before you can do one, you have to know where the community starts and where it ends. And make sure that it's adequately observed. Population size, socioeconomic status, and government structures would be observed during the survey. Any questions about windshield surveys? What's the most important thing to establish before you begin a windshield survey?
Boundaries.
Very good. Okay. So that's what we're going to emphasize on here. And then one example of a short windshield survey is on page 213 in your book if you wanted to see. But it seems like by this point, you guys have done a windshield survey, so you know what that is. And you know, and so you kind of know. Let me see here. Right, then we talk a little bit about evidence-based practice. And we know that this is how we practice as nurses. It provides a better nursing input and a better patient outcome because we use studies to determine what our practice is going to be. It's a current status of one's own practice and believing that best evidence will improve our care for our patients and how we perform. There's going to be barriers. What are some barriers with accepting changes with nurses?
Age and technology.
Good. Technology, they may not like a new system. What else?
Willingness to embrace the evidence-based practice.
And so I don't know if anybody's worked when the new computer systems come into effect in the nursing field, and I've done this a couple times, and there's so many people that argue and say, why do we have to change the charting? I like the old charting. Why do we have to get a new this? Why do we have to get a new that? So think about that when you see a question like this. Well, what's going to be our barriers? New technology, thinking that the studies aren't accurate or things like that is going to be some of our barriers that we see when we implement evidence-based practice. Natural disasters. I talked to my class about this week. We have our natural disasters, which are going to be ones that occur because something's happened in the earth. So we'll have volcanoes, avalanches, hurricanes, heat wave, a drought, landslides, tornadoes, floods, blizzards, wildfires. Does anybody remember the other kind of disaster?
Biomedical.
Man-made.
I think that was the term, man-made or human-made, I think is the term in the book. But yeah, so those are going to be ones that like a human has done something to cause it. So an example of that would be what?
A fire caused by like a cigarette thrown out.
Yeah, if it's a fire caused by, yep, very good. By something a human did. What else can a human do to create a disaster?
Pollution, warfare, water supply contamination.
Yep, good. All those. Yep. A new bioterrorism act will be human, right? So a question may be, a tornado is a type of blank disaster.
Natural.
Yep, it might be something along those lines. But that was one, but all right, any questions on that? I know we're going to go into Healthy People 2020 objectives, since I know you guys love this so much, and it's going to be on disaster mitigation, I think. Oh, no, I'm sorry. I'm jumping ahead. So this slide is about Healthy People 2020 and how they compare to 2000 and 2010. And now we have 2030, as you guys all know. So remember, Healthy People 2020 is going to be getting a little more in depth. We're going to be looking to prepare an alert for disasters. We want to make sure that a focus would be on increasing crisis and emergency messages to the public. And how are we going to communicate to the public? What kind of methods are we going to use to communicate messages during a disaster?
Cell phone alerts.
Yes, exactly. Think about when your phone goes off, everybody, like for Amber Alerts, everybody in the whole area will get, we get those in Colorado. I think everybody has them. It's when a child's missing or something, and so it alerts everybody's phone. So we have access to do that nowadays. So it's much better. We're going to make sure that we prepare if you need to, if anybody lives in a flood zone, they know what happens when you're getting close to that. So make sure. Access to recycling centers is an intervention, but not a preparation for disaster, sorry. So a question may look like, what would be important to do to improve disaster mitigation for Healthy People 2020? What's something that we talked about?
Sorry, can you repeat the question?
Sure. What's something that a nurse could do related to these objectives for disaster management? What are we going to be working on?
Teach the family how to prepare a kit for disaster.
Yeah, we're going to do that, but that doesn't have to do with Healthy People 2020, but perfect. That is a question that you need to know. But what do we talk about? The message center, remember? We're going to make sure that we're getting messages out to people through cell phones. How else could you do it if you were in an area where they don't have cell phone service?
Would they
Have-
locally we have the towers that make the loud noise
Oh.
outside.
Yep.
If that makes any sense.
Yep. And they do a loud alert and everybody in the area knows when that alert goes off.
Yes.
What is your alert for?
Weather related.
I'm sorry. what?
Tornadoes.
Tornadoes. I think we have them out here. I'm in Colorado. I think we have tornadoes and there's some other disaster that we get alerted for, but it goes to show I'm not really up on my alarms either, huh? that's not good. All right, we look at our disaster kit, which somebody just talked about. We're gonna make sure we advise our families to do this. What's important with a disaster kit that we know about?
Stock enough for 3 days and review it every 6 months.
Good, and make sure that we know the family knows where it is, right?
Mm-hmm.
So there may be a question on there, what are we going to ensure that the family knows how to take care of, prepare their emergency kit. So those are three big things. Everybody knows where it is, 3 days of food, and then 6 months checks. Okay, and of course, the food's gonna be not expired or anything that can expire. All right, purpose of mass casualty scenarios. Why do we do fire drills? Why do we do evacuation drills? Why do we do those?
To know the time frame
Time frame of what?
that it takes to like to get prepared for that disaster.
Right, and we want to make it quick, right? If we have an emergency, we want to be able to respond quickly. So what that does is it makes sure that we are, when we're doing them, we watch our timing and we try to get better and better. I work in a school, and so our fire alarms, as they go off throughout the year, we get quicker and quicker, and the kids know better and better and better what to do. So that's really what we're looking for, timing, and we want it to be as quick as possible. Think of all these scenarios where you're making sure that you can decrease your casualties, right? Now we have another one on natural disaster, and this is going to be our national response framework. So I'm emphasizing this because we would like to know what the role of it is. And it's to support a community during a disaster with transportation, housing, medical resources, and firefighting. Okay, so think about what a natural response framework would be, NRF. It's going to be all the people that we're going to get involved to help with a natural disaster. Okay. Any questions on that one?
No.
Teaching. All right. When we're looking at teaching and education, this was a couple weeks ago, we covered this in class. So in developing a community-based education, we need to make sure we determine, just kind of like in a windshield, we do our boundaries. When we're teaching, we need to know who we're teaching to, right? And then we're going to look for what's the problem or what do we need education on, select one of the theories that we talked about, and then choose how we're going to do our strategies. Does anybody remember the 3 different areas of teaching theories or the domains?
One is affective domain,
Yep.
cognitive, and psychomotor.
Very good. And remember, the way I told people to remember in my class, affective has 2 F's in it. So it's feeling. Cognitive, think about what cognition is. And psychomotor has the word motor right in it. So any motor that you know moves. So that's how you remember those 3. And here's our little picture here, but we just sort of went over that. Then we're going to look at, was our teaching effective? So when we're teaching to our patients, we're going to make sure that we do what kind of method to see if it was effective.
Teach back.
Give me an example of a teach back.
Someone who is a diabetic and has to check their sugar.
Okay, so what are they going to do in order to show you teach back?
Demonstrate how to do it properly.
Good. They're going to do it right in front of you and teach it back to you as if they're the teacher now. Okay. So we want to make sure that if you're doing a skill like that, you want them to show you exactly what they're going to do, right? And when we're looking at teaching, we want to make sure that we know what our content is and be very specific in your content. So like when we teach in classes to you guys, we try to be very specific. Chapter 25, 26, 27 is this week. Chapter, we're very specific in the content that we teach. Know that you're also going to make sure that handouts and posters, great things to have. I like to use PowerPoints a lot because obviously I'm not going to give you guys handouts, but when you're thinking about this, thinking of being a nursing student and what's really helpful for you, because that's really how I like to teach this, because you guys are students right now and your patients are going to be students as well. try to avoid stories that are, too detailed, like, oh, the data, the blah, 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 blah. We can do that as nursing students, we can learn about the data, and we know hypertension and we know diabetes, but a lot of people say, what's hypertension? Make sure you're using very basic words, regardless who you're talking to, unless you're talking to someone that is, a medical professional that knows the terms. Just be careful about that. We also know when we're teaching to anybody, there's tons of different learning styles. Remember, we're looking at our generations, and some of the generations we talked about were Generation X, who like to work in team. Our net generation likes digital. Baby boomers like person to person. They don't like any of the technology, that kind of stuff. What else? Let's see. So if I were teaching to a group, to a net generation, what kind of teaching would I do?
Digital.
Meaning something like what?
Virtual reality.
Kahoots, web-based games.
Yeah, Kahoot's good. That's a great example. Kahoots. Sometimes they have online young kids, they'll give like math games too, and they're fun and they're interactive, and then they can play with them. And then that's a type of digital method that we would see. If we were going to do Generation X, what kind of teaching would we do?
Group projects, teamwork.
Yeah, group project.
Yep, you're going to work with group projects, group activities, stuff like that. Okay, so I want you to know the 3 different generations and what they like. Any questions on that one? All right, then we look a little bit into the legal and medical malpractice. We know that we have, when we're trying to prove medical malpractice, we're going to look at our liability, and we need to know that in order for this to occur, the provider has to have a duty to provide for reasonable care. If that does not happen, then that's a liability breach. A breach occurring through an act or omission to act. So if something doesn't occur, and then we have whatever happened caused harm or injury to our patient. So that's how we would see our liability being tested there. Case managers is an area where we would be really careful to not miss a loop, as we talked about. Case management. I'm sorry, hold on one second. Case management is something where we work a lot with, and so you're going to be working a lot with your patients, to make sure you don't miss a step somewhere along the line. Just hold 1 minute, please. Sorry about that. Okay. We look at our legal issues. What do I want you to know about that? Legal issues, we're looking at our liability again. What are our 3 things that have to occur in order for liability to be a concern? We're going to have an act that hurts somebody, didn't do something, an omission or forget to do, and the provider had the duty to provide reasonable care. So the provider was doing what they were supposed to be doing. Okay, so it's not like you can fault a CNA for writing a script that the doctor wrote. That's sort of a way to understand that. Okay, but the doctor can be responsible for that. So whatever they're performing, you need to know that they are able to do that. All right, so we're going to look at our liability and the 3 things I want you to know about them. Okay. Okay, our Sheppard-Towner Act, which I did not cover, and I know some of the professors did, but anyway, so we had this occur, and it is to in 1921, and the reason for it was to help with public health and public health policies, with early developmental screenings, services to women and children by nurses, and making sure that we were able to have government in our education and collection of data. So this Towner Act, what it did was it helped give stuff to moms and babies, prenatal and newborn care facilities, developmental screenings, government and research, system for collecting health statistics. So it was an act that did a lot of things. If I were to ask you, what are some things that this act did, what would you tell me?
Help provide education to mothers and children.
Good, and give me specifics. What kind of screenings did we have?
Public health screening, vaccine screening.
No, we had early developmental screenings, like is this kid walking and talking and doing what they should at this point? Then we also had the role of what in research?
Government.
Yep, the role of government. And we also had a system for conducting our health statistics, right? So we're going to focus on those three things with our Sheppard-Towner Act. All right. What's our focus of Healthy People 2020? If I asked you that, what would you guys tell me? You've done it all quarters, so you know. What's our goal?
Reducing health disparities.
Not reduce, but what are we trying to do to everybody all across the board?
Have a high quality life with preventable diseases or preventing preventable diseases.
Yeah, we want a long life.
Increase the use that they
Go
live.
ahead. Say that again. Somebody just contributed something good, but
Increasing life.
yeah, making a better quality of life. Yeah, and reducing what?
Diseases.
What kind of diseases? How about preventable. Yeah. Good. I know somebody just said that. You want to do those preventable ones, right? Because we can do something about it. So they're all goals to do that. We look at the organizations that help with public health, and we see the World Health Organization. And we do a bunch with the World Health Organization. We do standards for vaccines. We do biomedical research. We do information on international occurring. We look at public health initiatives. Really look at the world as a whole and how can we have everybody improve. Okay, so when you see the World Health Organization, you want to remember it's worldwide and it's taking care of everyone. We're going to look for drug outcomes. Sorry, there was just something flying there. We're going to look at drug outcomes. We're going to look at promoting health. We're going to look at international diseases, standards for vaccinations. We have research that we look at. Making sure that countries talk to each other so that they know what to do when something occurs, like during COVID. You would hope that the World Health Organization was on board with all the countries as it was occurring in China and Italy and then here, and how we worked with it and things like that.
You mad talking about a crap, man.
All right, Agency for Healthcare Research and Quality is another organization that we see that's pretty important. And what we do is we look at this for quality and effectiveness, safety, research and quality. And so we know that it supports research. It says right there and there.
Can you stop her back? She got some money.
I got you.
Hold on one second.
All right, see you later.
Okay. Sorry about that. Alrighty, so agency, we know it has to do with governmental agencies, and we look at the CDC and what that does. What's the CDC do? Anybody know CDC?
Tracking diseases and trying to prevent them.
Good. Yeah, You're gonna try to prevent them. What else can we see? All right, here we see the nursing process and case management. So as a case manager, you know you're gonna do your ADPI here. You're gonna look and see what are the cases, what do I need to do? What can I do to help them identify where there's gaps or something missing there? We're gonna make sure that we determine, are they eligible for new services? We're gonna look at screenings, assessment methods, and then we do our diagnosis. We're gonna identify our problems. We're gonna determine how our assessment was conducted, plan for outcomes, implement, and educate. Your ADPI is going to be seen throughout your test. Any questions on nursing process and case management?
Oh, ma'am.
Okay, thank you. All right, when we look at nurse case managers, we're working to coordinate care, meet the health and well-being of coordination of care. Healthcare providers have specific roles that provide education, intervention, and support to clients. The nurse should report to the nurse case manager if there's any coordination that needs to be done. What kind of coordination might need to be done on a CHF patient?
Follow-up appointments,
Okay, follow up. What else?
maybe some, my mind just went blank.
No worries. What?
Durable medical equipment.
Yeah.
Dietary.
Yep. All that stuff. Yep. Absolutely. Alrighty. Any questions on case management, coordinated care, kind of? All right, I'm going to stop sharing for 1 second. Any questions? What we've gone over so far
No.
up to this point? Okay. Pretty much a review, but remember what I'm going to tell you is that your test will be like it was last time. So it's going to be a lot of application, meaning you know the data, but then you'll have to apply it to certain situations. Does that make sense to everybody? So instead of just saying, where would we collect data from in a community? We're working as a nurse in a community. Where would we look to see it? Something like that. Okay, so it's not just going to be cut and dry. Does that make sense? Just something I want to remind you. Math, you're going to have your 5 math questions. So review those. I'll look at them and see which type of math you'll need. But last time, I felt like the math questions were pretty easy. Did anyone else think they were easy on the test? It wasn't too difficult. You didn't
Yeah,
really
they're-
have to
No,
do,
it wasn't.
you didn't
They
really
were
have to do math.
straightforward.
Yeah. It was, 1 was the answer for a couple of them. Alrighty, let's see here. Sorry, I'm just fixing something that I want to make sure we cover. I will have this recording, like I said, I will have it out there for everybody to see. I'll send it to the professors when we're done with our meeting and see how that goes. Oops, alrighty.
Are there Kahoots for weeks 6, 7, and 8?
There's Kahoot for 8. I used
Okay.
it, but I'm not sure about the Kahoot situation. I don't think we can share that. But I don't know. Do your professors share it? Because I'll send an email to them and ask.
They tried to share it, but it says it's expired.
Yeah, so there's a time frame on the Kahoots. That's what I thought. I knew there was something weird. So there's a time frame on the Kahoots. And so they do expire. But my class I recorded the part of the Kahoot on, but I don't know, maybe if you go back and review, Kahoots are a little hard because sometimes we use them and sometimes we don't. I wouldn't spend a whole lot of time on Kahoots in the sense that I would focus more on your study guide. Does that make sense?
Yes, ma'am. Thank you.
Okay. I know Kahoots are good because they help you, but I'd focus more on what's on our study guide. Alrighty. We are at case management we covered. All right, primary, secondary, and tertiary prevention. Remember, there'll be a question or 2 on this. Primary, we remember is what?
Preventative.
We're gonna prevent something happening, so that would have to happen before or after a disaster.
Before.
Before
And then we have our secondary prevention, which is gonna be what?
screening,
Good. And so we're gonna screen those people that were exposed to the disaster and see if there's anything that occurs. And then what are we gonna do for our tertiary?
The management after it happens.
Yeah, so we'll work with that. And I talked to my class about, remember when you're dealing with disaster management and anything like that, remember to pay attention to those, to the nurses that are part of that disaster recovery, because they're probably having their own disaster at home if they were part of the overall disaster. All right, we know vaccines are our most effective method of preventing and controlling diseases. What happens is when we look at that, we'll get an antibody, and then once the body gets hit with it, then the antibody will fight it off. You know, those things that occurred in epidemic proportions can now be controlled by this, but they haven't been eradicated, right? So we know measles was on the rise a couple of years ago. So you want to encourage vaccinations to your communities. STDs, major concern in our health industry. Most of them are cured with antibiotics. Know that bacterial ones are going to be cured, like gonorrhea, syphilis, chlamydia are going to be cured with those, but those viral ones, you know, we can't cure viruses. So remember that. And when you look at it, remember your 3 bacterial ones that could be treated with antibiotics. Syphilis, we know transmits through the placenta. So we're going to be really careful about that on our pregnant patients. And you guys did work on infectious diseases, so that was good review, I think. Surveillance. So we look at disease surveillance as the ongoing collection and interpretation of data use. Surveillance means we're going to monitor our trends, and public health is going to be monitoring, preventing, and controlling the spread of disease. CDC is our public health people, and they're going to be our foundation. All right, we look at active. Go ahead.
Oh, it went out for a while. I couldn't hear you.
Okay. So we talk about our surveillance or different types. So we have disease surveillance, where we're going to look at what diseases are occurring in a community, and then we're going to look at surveillance, what it does. It provides a means for nurses to monitor disease trends, and then we have our public health surveillance, which collects and monitors our spread. Here's an example. It's not very clear though, is it? All right, so example surveillance systems, what we use them so that we can try to protect the greater community. We have a passive system, which is going to it's going to be passive again. So it's going to be, they're not overly active. We're just going to have healthcare providers report. And then we have our active system, where we go out there, we search for cases, we get in touch with them, and we make sure that the cases are found in our surveillance. Any questions on that? So if I were to ask you, give me an example of an active surveillance, what is something you would see in an active surveillance system?
Someone
They-
contacting the provider.
Yeah, good. So think about active and passive. Passive, you're just kind of sitting back waiting for it to come in. Active is when you go out and you recruit the information. Is that good? You guys need to know the difference between the two. All right, now common source outbreak is when we have different patterns of occurrence. So this is part of our surveillance chapter on outbreaks. So a point source outbreak is when all people become sick during one period of time, okay? And they can be exposed to the source, well, exposed to the one source. Oh, hold on 1 second. Intermittent is cases may come intermittently or over a period of time. We'll see that with food poisoning. We'll see that with other things that may be exposed, but it'll come over a period of time, not all at the same time. And then we have a propagated outbreak, which doesn't have a common source and just spreads gradually from person to person. Okay, such as like TB. So when we're looking at health program developing, we're going to move on to health, a little bit back to education, but it's with health planning for community-based programs. We're going to make sure we do a needs assessment, right? And we make sure that during that time, we're going to have a pre-active phase, a reactive phase, and an inactive phase. And those are our 3 phases that we worry about when we're talking about that. Okay. There's some stuff that was on your study guide. There was one topic that wasn't. Okay, now we look at quality improvement. And we talked about that in my class a little bit. Quality improvement is going to be improving performance, focusing on preventing, identifying opportunities. Quality assurance focuses on accountability by detecting errors. What are we going to focus on with our quality improvement? What's our goal? Quality improvement.
To become better.
And identify the improvement opportunities.
Yeah, we're going to improve the quality, right? We're going to make it better. Okay. So some of these are, you know, I hate to say common sense, but I want you to apply it to what you know. So you know what quality is, right? So for continuous quality improvement, what are we trying to do? Make things better. All right, we look at ways to help with these quality improvement programs. We're going to improve client satisfaction. We're going to focus on staff to make sure they know how to treat the patients for, you know, customer service, education in different languages is always helpful for these type of things. Adjusting hours of operation helps more people come to these kind of quality improvement programs or participate in them. And then we look at our tracer method, which we know is a method to measure or process and outcomes of care. And when we have that, we're going to have groups of clients who are selected to evaluate differences. But what we want to look at in a tracer method is we're going to look at a group, and the group is going to have all similar characteristics going on so that we can measure the outcome. Because if we have a group of people and they don't have a similar basis, then we really have difficulty with evaluating the program and seeing if it works. Okay. Any question on quality improvement? Tracer method is one of those you want to know. So tracer, you trace along and see how things worked. What's your basis for a tracer method? What's something really important with a tracer method?
They have similar characteristics, same stage of disease, illness, lifestyle.
Yep. All that. Okay. We have the tertiary quality prevention, something like our adverse reporting system. And we saw this with COVID, anyone who got the vaccine, you get these continuous updates. Like, have you seen anything happen? Have you felt bad? Have you any of those things? I don't know if anyone else has gotten them, but I know here we do that. So we're looking at a national surveillance system. This is going to be tertiary because they've already had the vaccine. We're going to track the community and see how that prevents the diseases. And we're going to develop education on vaccines as our primary, and providing a low vaccine clinic would be our secondary when we're looking at vaccines. Okay, so we have primary, secondary, and tertiary. Tertiary is going to be that group that looks at what happens after the vaccines. Primary, we're going to be looking at education. And our secondary, we're going to be giving vaccines to them. Any questions about that? All right, ethical principles. We know the National Research Act.
Actually, I have a question real quick. You
Sure.
said secondary was giving the vaccine?
Yeah.
Okay.
Well,
I thought-
providing a clinic, not giving it. Like, you'd have to set up a clinic because it's allowing them to, you know, it's allowing them to get it before the virus comes. So it's a screening method because we kind of screen, we're not going to give a vaccine to someone who already has it. So when we're developing those clinics, we're going to be screening and see who wants it, who's getting it, who, you know what I mean, who would like it, that kind of thing.
Okay,
Vaccines is sort of a, it's like a little difficult sometimes to understand with primary, secondary, and tertiary. So I want to make sure that's clear. Is it?
so,
Yeah.
so would vaccines of any type be under secondary?
Well, so it's not so usually when we're doing vaccines are going to be primary. But when we're looking at a disaster or management, we're going to look at with like our vaccine adverse reporting system, this is going to be our tertiary system. So think about that. You're going to look at see what happens after the vaccine has occurred. That's going to be tertiary, right? Because we're going to know that they've already gotten it and how that's impacting them. So developing an education system, anytime you're educating, it's what level?
Primary.
Mhm. And then your secondary is going to be screening. So if you set up a clinic, you can do some screening at the clinic, who's getting it, not the actual giving of it, just the setting up of the clinic. Does that make more sense?
Kind of.
I know, it's vague. I'll give you a bit of advice. Know that tertiary is this kind of vaccine system where we report after. Does that help?
Okay, yes.
That's what I want you to focus on. Okay. Anytime you see education, you're probably never, it's not going to be tertiary. All right, we look at where are we going back here? Oops, social equality, I think is our next one. We have our two different types of our utilitarianism is going to be our ethical theory that the outcome is important. So what happens at the end is really making sure that our actions are justified. And then we have this next theory that adheres to moral rules and duties rather than consequences. When we look at distributive justice, we look at whether the action will create a burden, because remember, justice is our treating everyone equally. So we don't want to get a burden out of that. And that's about it. All I want you to know on that. Consequentialism has the word right in it, consequence. So it's about what's the consequence of the action. Okay. I just look at something real quick. All right, if we were looking at the utilitarianism theory, what is it that we're going to be focusing on? What's the basis for this?
The ends justify the means.
Mm-hmm. Good.
For the greater
Alex,
good.
you're doing a good job because I think this is all on your study guide. So if you have your study guide in front of you, the answers are right there. Thank you, though. I appreciate you commenting. We look at social equality a little bit, and we're going to know that we have feminists, our feminist ethics, which is going to advocate for economic, social, and political equity, and reject abstract rules and principle. So when we think about social equality, I want you to think about feminism, feminist theory. Okay, it's our economic and social theories. When we talk about immigration, when we're working with a group of immigrants, what do we know that they face? They're going to face your financial constraints. They're going to have language barriers. You're going to have traditional practices that may not occur in our country. They may have trouble getting used to this new land that they're in. I work in a school and we had a lot of Afghani immigrants come in, and for those little people and for the parents, it's really hard to understand the way the way people are treated, and they are coming from a very different society. So all those things are important to remember when we're looking at our immigrants. Refugee is clients who have left their home, usually because of a disaster or horrific circumstance. So this is like the Afghani people that I just told you about. So they experienced trauma. One of the families was hidden under planks of wood for a week before they could get out. So things like that. So our priority is going to be accessing care to therapy and making sure that they can get some help for what they've experienced. Okay. Our priority with these refugees is always going to be their therapy because of the trauma they've gone through. Okay, but we're going to remember that they've just come against language barriers, changes in culture, different beliefs, different rules. So they've gone through a lot. And how can we help? When we look at our Native Americans, you remember that they're past oriented and they may not be concerned about the future. And for our Hispanic, I think that's next. With our Hispanic group, we're going to make sure that we avoid negative expressions and they like direct eye contact, they like physical contact, things like that. Okay. Any questions at all on this? That takes us to the end of the review. That's why I'm asking. Any questions? I can text one of the professors and ask about the Kahoots. You want me to do that? I'll have an answer for you. Make sure everybody puts your name in the chat with your professor so I can take attendance. What else can I say? I'll stop sharing. Do we have any questions at all? Outstanding questions about, I'm gonna look at the math.
Yeah, that's what I was gonna ask was how the math was.
You're gonna have to do some math on the math problems, more math than you did last time. If that helps. Make sure you review the conversions and things like that on your math, okay? What else can I review? Anything? Study your study guides. You guys are pretty quiet. Oops.
I was just waiting to see if like I don't want to do the Kahoot. I don't want to spend time on the Kahoots if they're not really going to be beneficial. I think they were more beneficial.
I wouldn't
for
say
the
they're not
first exam.
beneficial. So
Okay.
maybe I misspoke. What
Okay.
I said was I would focus on the study guide. If you have extra time or you want to review, they're good because some of this content on the study guide is on the Kahoot.
Okay, that helps.
Does that
Thank you.
help? So I don't want to tell you don't do them, but I don't want you to focus all your energy on Kahoots and ignore the study guide. Because we write that study guide to help you guys really focus. Oops. She's not answering. Hold on. Has anybody else had a professor that shares the Kahoots? I'm just curious.
Yeah, I did some of them from Professor Price.
I don't know.
All the pediatrics teachers, they share.
Yeah.
I've never been able to get into them, so I don't even know how to do it.
Do you guys want to do a little bit of one or two?
Yes.
Yes, please.
If you guys don't want to stay on for the Kahoot, I won't be offended, trust me. You guys can go. I will send my recording to all your professors. We'll do a Kahoot though, for those who want to stay on.
Is that recording gonna come tonight or?
Yeah, I'll send it as soon as it has to convert, but as soon as it converts. I'll send
Okay.
it. So they should all get it tonight. I can't speak to that. They'll post it tonight because I don't know when everybody gets online, but I will make sure of that. All right, let me see what Kahoots we can do.
Oh, well, it'll post to YouTube, right?
Yeah, same as, yeah.
Okay.
Let's see what Kahoots I can I'm just looking, guys, what I have that would be helpful. Mhm. You want to do one on evidence-based practice? Or we can do week 8's community.
Week 8, or yeah, either one.
Either one, okay. Let's do a little bit of evidence-based practice, then we'll. All right, everybody know how to do Kahoots?
I don't, I've never done it.
All right, just go to kahoot.it. And then it'll ask you for a code, and I'll give you the code in a second. I'll
Amanda-
share my screen with you and you'll be able to pick the answers. You can make up whatever name, I don't care. All right, so here's our Kahoot pin. Hold on. Okay, here's our Kahoot pin. It's 754-5194. Everybody on who wants to be on?
No, not yet.
Okay. All right, we ready? Here we go. This is evidence-based practice. Lowest level of hierarchy of needs. This was evidence-based practice.
What was the pin again?
Oh, I don't know. Does anybody have it? Oh, yes, I do. 754-5194. Think of that hierarchy of needs that we had with Maslow's. Right, so we have our psychological needs. 3 of you got that. 1 of you got love and belonging. 1 said esteem and no safety. So that was good. So our psychological needs is going to be our lowest level of needs with hierarchy.
When you say lowest level, you're meaning not priority, correct?
Yeah, yeah, his triangle. It's not that it's not a priority. It's what's most important or not most important. Ethical foundation for evidence-based practice lays in what? Alrighty, so most of us got that one. That's providing interventions. That's we have to believe that our evidence-based practice, the ethical belief behind that is that that has to work, right? Because otherwise evidence-based practice is invalid. What's the purpose of Healthy People 2020? Promote health for chronic illness, emphasize health promotion, offer healthy development, ensure health insurance. I think everybody answered, so I'll click skip. Right, we know that it is health. Nope, it's not chronic illness. Please Remember that, guys. This is we're trying to keep people healthy. There may be some chronic illness thrown in there, like for asthma in kids with school nursing. It's to promote those kids with asthma to have a higher attendance rate, but it doesn't focus on the asthma. It focuses on their how to promote their health and to be better at it. Okay, so you're not going to see the word chronic illness with healthy people 2020 usually. What is evidence-based practice? Right, good. Everybody got it? Good. All right. So evidence-based practices, when we're going to be using that evidence that we found to change what we're doing. Okay, so we're not going to be finding the evidence. We're going to be using it once it's already been found. All righty, next. Let's see here. Which of the following is not an evidence-based practice? All right. Oh. You guys got that all right. Oops, I skipped ahead too far. Sorry. All right, let's look at another one. Scientific evidence should be based on. Good work, all of them. You want observations that are gathered to reduce biases. We want a large, diverse sampling, and you want comprehensive observations, right? Not just one simple observation. RN is working as a case manager with vulnerable population. What action should the nurse do when providing care? All right, so we want to make sure, remember, vulnerable populations are going to need a lot of follow-up. They're going to need you constantly there with them. You do want to promote some self-sufficiency, but you don't want to take away that dependent on the nursing. You want to really, our best answer here is going to be entering that long-term relationship. You're going to be with them for a while because they're going to need lots of support along the way. Okay. So on that one, it would be best answer, but we already did this one. Let's see that. Oh, good. According to evidence collected, which is tertiary prevention? Remember tertiary, what that's going to be. Well, that took a while. We only got 4 answers. Remember, when you're a tertiary, you're dealing with treating. Okay. So somebody said an article that's an opinion of expert. You're not really doing much prevention there on a tertiary level because you're not doing any treatment, right? It's just an article. Sorry, it says educate. Educate. Maybe that's why it was confusing. Multi-select here. This is kind of, we did this already. I'll skip it. Evidence-based decision-making requires which of the following? Very good. It's not gonna be trial and error. Decision making is when we are gonna have our expertise, we're gonna have our evidence and our patient preferences. That's how we develop evidence-based practice. A nurse has collected several findings for evidence-based practice. Which article will be best? Now, remember what evidence-based practice is based on. But we went at that randomized control. An article that is peer reviewed is not necessarily as accurate as something where we're gonna have from randomized controlled trials so that we know that it's been repeated, we can figure out why and things like that. All right, we're gonna close out of this one and I'll do chapter 8 for a little bit if you guys want that. Do you want chapter 8?
Yes, ma'am.
please.
Yes, please.
Alrighty, here's our pin populating. 329. 3293180. Team Awesome, that's a good one. Okay, here we go, guys. Which of the following is most crucial in a generic ethical decision-making process? Remember that first step we talked about? What's the first thing you have to do when you're making this decision? Oh, no. All right, only one of us got this. Remember, before you do anything in that assessment phase, you're going to be identifying what our issues are. Okay, it's the first and most crucial step. You're not, maybe you guys picked assess the content or environment because it has the word assess in it, but remember, before we do any of that, we have to identify, kind of like in a community, we have to identify those boundaries. We have to identify what we're dealing with. When we're
I picked assess. Well, I was torn between the two, and then I said assess because you're gonna, in order to find out what they need, you're gonna assess the environment and those things they have going on there. And I mean, I feel like both of them are kind of
Yeah,
similar.
they're close. I would agree. But you, before you make a decision, you have to decide what's the issue and what's the dilemma. So that would be your first. You're not going to necessarily assess the content or environment because that's not going to really impact an ethical decision making. Does that make sense?
Okay. Yeah.
Yeah. It's just not, it doesn't apply as well as identifying what our issue is. All right, good. Number 2, multiple choice. National Research Act established the I don't think we went over this in this review, but take a guess. It's the best you could do. All right, so it did two things here. So you guys figured out protection of human subjects, which was good, Natural Research Act. And the ethical principles that you follow is our National Research Act. Pretty good, you guys did pretty well on that one. Another multiple choice. This one's a little confusing. I did this with my class, so I'm gonna skip it because I think it confuses more than it does. What is autonomy? You have two answers here. I think we only have three of us playing, so let's skip to the end. So our two are gonna be, all right, well, so we didn't do too bad. Autonomy is gonna be independence, remember? So we're gonna get informed consent, making sure they're making their own choices, they're doing their own thing. And then it's that individual's right to make the choice for their life. So everybody got that one right, so good. And informed consent is, because they can decline, they can say, no, I'm not signing consent to do this or that or whatever. So it's giving them the independence to make their own medical decisions. Okay.
And I'm playing along. It's just not letting me choose answers. So
No worries. Okay. I don't think you need this one. Utilitarianism. Utilitarianism. I do want you to know this. Ooh, good work. We reviewed that one. Remember, the action must justify the means, and so our outcome is key. The way you might want to remember that one is utilitarianism. It starts with a U, and we're focusing on our outcome, which starts with an O. I like to do a lot of that SO, or UO or ST, those kind of things, just to help you remember. I don't think you need to know this one. But... Distributive justice, we just went over this in our review. Distributive justice means what? Remember, justice is fair all around, but it's distributive. I was afraid I would do that. I think some of you guys picked the fairness ones because I said fairness, but no, it's whether the action creates a burden. Remember, we talked about you have to look at, is the action going to create some harm when we're looking at distributive justice and unfairness. Now, feminist ethics advocate for, I want you to know this. Economic fairness, abstract and rules, political and social justice. Very good. Nice work. All of the above. I don't think you need this. Wouldn't spend a lot of time on that one either. Immigrants had an impact on American culture by creating a new money system, refusing to attend schools, forming their own political parties, sharing their customs, languages, and religions. We'll skip to the end. I hope everybody got this right. Yay! So we're gonna be really sensitive to immigrants and how they impact our culture by sharing all their stuff that they have with us. What factors must we think about with immigration? Very good. All of the choices. We worry about financial, language, religion, social, cultural, traditional, All of those are we're gonna worry about with immigration. There, we'll do 2 more. Who are refugees? Good. Oh, it was people who leave due to disaster. Sorry about that. All right, here's the last one. In Native American culture, you need to know this for your tests. What do we know about them? Good. It's their focus is may not be concerned about the future. Okay.
They're past oriented too, though, right?
Yes, yes, but their emphasis with them, what I want you to remember about them is like, you know, you got to make those appointments. They're not future oriented. Here's another one we just talked about. What do you want with those, this kind of culture? You're gonna multi-choice. Good work. You guys got them all. Very good. Physical contact, eye contact, and no negative expressions. I see that as a negative. It's not a positive thing. Good work. You want to do a couple more? Very good.
Yeah. I'll keep playing.
Okay. Observation and surveillance is the process of this is kind of definitional. I don't really love this one, but all right, so you had 3 of those choices there, but I don't like it because I felt like blue is not good. It was definite a no, but you know, we picked blue as one of them, but I don't like the dissemination. I don't like that word in there. But yeah, you're gonna analyze, interpret, ongoing collection, all those. We'll skip this one. All right, purpose of surveillance is, it's a multiple choice one, maybe multi-select one. Oh, we ran out of time there. All right, so when we're surveilling, what we're going to be doing is we're going to be looking at the control of the spread of diseases. We're going to be trying to reduce our mortality. We're not going to be looking so much at infections. We're going to be more looking at our diseases process with surveillance. I don't like that one. Which is not a surveillance system. We talked about 3 different kinds. Good, you guys remember. All right, one more and then we'll go. Passive surveillance system. Remember the word passive. Sorry about that. The dogs decided to bark in the midst of that. All right, passive surveillance system. Good. We're going to rely on those people giving us the information, and we're not going to be doing anything actively. All right, good work, guys. I'm going to stop sharing here. All right, so I will send my review. Any last minute questions?
No, ma'am, thank you so much.
All right, good luck to everybody. It's your third one. You've gotten this far. You're gonna do fabulous.
Thank you.
All right,
you.
take care. You're welcome. I asked about the Kahoot games, Christina, and I'm not getting an answer, so I'm guessing no.
Thanks again.
If I get an answer, I'll ask everybody to put it in their announcements, okay?
Yes, ma'am. Have a good
Okay.
day.
You too. Bye-bye.